surgery I had done was on my right knee, partial knee replacement, and Dr. Adam Freedhand did the surgery. I call him the wizard, though. Actually, I had 2 arthroscopic surgeries on medial meniscus on my right knee, one in 1985, one in 1986. And by the time I saw Dr. Freedhand, I'd had several other thoughts about, you know, eventually I'm going to have a whole knee replacement. And when he saw this, gave me some, when I saw the clip on TV, it gave me some hope. And so I made an appointment that very day. Been an athlete all my life, and you know, had football injuries, and that was the reason for originally the arthroscopic surgery in 1985. I was a martial artist for 30 years, and you know, it just took its toll. The pain was such that it was present about 90% of the time, and you know, I lead a very active life. I've been retired for 6 years, and you know, I dance 4 to 5 nights a week, either in dance classes or out with a group of dancers. And so, you know, I could get by and dance, but I mean, I didn't feel fully functional. You know, some moves I couldn't do, and then by the time the evening was finished, usually I would dance for 2 to 3 hours. You know, the ride home was oftentimes 30 to 45 minutes. And that length of time just being, you know, the cool down, and then when I get out of the car, I just almost couldn't bear the pain. I checked in that morning. Dr. Freedhand did the surgery. The next day, I walked out of the hospital. I mean, I'm amazed. What's even better is that they scheduled a follow-up appointment after the surgery, 2 weeks after the surgery. I'd already asked him on my initial visit, now how long before I can, 2 questions, how long before I can exercise, how long before I can dance? This is all a couple months. I said, are you kidding? I said, that's too long. He said, well, we'll see how your progress goes. So on the 13th day after the surgery, had an appointment with him. He checked my flexion and checked my knee strength, and he said, wow. He said, are you doing physical therapy? I said, well, yeah, you prescribed it 3 or 4 times a week, and the physical therapist wanted me to do these exercises, and you know, I was diligent about it. She wanted me to do them twice a day. I did them 3 times a day because I really did not want this to get froze up, or a term I hear sometimes, you know, if people are not persistent with physical therapy. Anyway, he said, that's amazing. I said, well, when can I dance? He said, now. I said, are you kidding? He said, yeah. He said, you can dance now. So that was on a Tuesday. On Friday, Saturday, 17 days after the surgery, I was back on the dance floor for an hour and a half. It was so awesome. And a couple of my buddies who I'd been talking to about this, they were dealing with the same thing. A couple of them retired. And I said, you have to do this. They just couldn't believe I was back on the dance floor. And he's such a gentleman, and he's so easy to talk to. That's my favorite thing about him, is, you know, we just, it's so easy to speak with him. Just that he's, you know, one of the other things I like about Dr. Freedhand is his warmth. But, you know, I think that, you know, I'm retired from the medical device manufacturing business. I own 3 international manufacturing businesses, medical devices. And I think that professionals ought to dress like professionals, and he always wears a tie and a jacket. I love that. Aside from his warmth, you know, he's not one of these uppity doctors. I like the fact that he dresses as a professional, but talks to you as a layperson. I love that part about him. The quality of his service, his professionalism, is unsurpassed, in my experience.